right, welcome back. I'm your host, Michael Stamatinos with the Advancing Healthcare Innovation Show. And if you're new to us, we're just super excited to have you here. We happen to be crazy passionate about healthcare and innovation and adoption. And if this is your first time tuning in, let me tell you a little bit about what we do here. We're a healthcare innovation company that's focused on bringing real stories from real people that are innovating within our space and looking at what that actually looks like in the workplace. And our aim is actually just to highlight these folks, let them kind of share and broadcast their story. We've got an incredibly action-packed year with some amazing interviews. And if you haven't checked out any of the historical interviews or content, make sure you do that right after this. And that's hit the subscribe button if you haven't already before. But I'm delighted today to bring in Dominick Bizzarro, who is the Chief Growth Officer for MVP Healthcare. Dominick, welcome to the show.
Thanks for having me, Michael. I am a subscriber, so I encourage others to subscribe, and I really enjoy your interviews.
All right, I did not pay you to say that, so thank you for the shout out. Really appreciate that. So, yeah. Dominick, your story is really interesting. Just kind of enjoyed getting to know you a little bit more. But your background, you're a clinician at heart. Maybe before we kind of dig in a little bit and talk about your view on innovation and what you guys are doing at MVP. Maybe share a little bit of context with the audience, a bit about your story, kind of where you are, how you got here, and what you're excited about now.
Sure. So I did begin my career as a pharmacist, but even before that, I kind of grew up I had immigrant grandparents, and my grandfather owned a newsstand, and I worked for him since I was 10 years old, from the time I was 10 to 13 till I got a real job. And all of those jobs were focused on customer centricity. So for instance, at our newsstand, it was in Fort Lauderdale, Florida. We were originally from New York. There was a lot of transients to New York. They wanted the New York papers, but the customers tended to come in at a certain time every day. So I had to write their name at the top of the paper in the order in which they came, right? So it was those little things to focus on customers, try to make it a great experience. I kind of looked at what I really enjoyed. I enjoyed science. Certainly, I came from a customer-centric service type of industry. So I landed on pharmacy, and I was a Walgreens scholarship kid. So I worked at Walgreens in the camera department, the liquor store, which actually, and the pharmacy. I would work in the pharmacy in the morning and the liquor store in the afternoon. And sometimes I'd see the same customers. They were a lot happier when they walked into the liquor store, sometimes when they were walking into the pharmacy. But Walgreens taught me a lot about systems and the importance of systems to really anticipate needs of customers. And Walgreens was an incredibly innovative company back then. We had the first, this is back in the 80s, first satellite network. So all of our computers prior to the internet, all of our computers were connected, so you could pull people's records up, the inventory management systems, automatic replenishment. So it was an innovative company, but they really kept it simple. There was like a Walgreens way of doing things. Mm-hmm. And then from there, I went back to school to get my MBA in health systems and started a journey in working for about 9 or 10 different companies that kind of half the time on the vendor side. Sometimes on the provider side, I was president of 20 physician practices, and have worked for a health plan twice. And then I was the CEO of the Health Information Exchange of New York that was responsible for connecting disparate medical records across the community. And from there, spent 4 years in international healthcare as the global managing director of the health share product for InterSystems. So I've had kind of a varied career, and it's taught me a lot of different things about innovation, but it starts with customer centricity and a growth mindset, and really focusing in and defining who your customer is. And then how does your organization reflect the culture of innovation? So it's been a lot of lessons learned, and as you know, not all those lessons are pleasantly learned, but those tend to be the ones that you remember.
Yeah, I mean, I'd love to just kind of embarking on, it sounds like you've done quite a bit of tour of duty. It's funny when you were talking about working, having immigrant grandparents. So my parents are immigrants. So having grown up in the restaurant business, we didn't have newsstands. We had diners, and you begin to figure out being able to deliver a hyper personalized experience to a customer. For example, like I knew our top customers, I knew exactly how they wanted their coffee.
Yep.
You know, this guy was light and sweet. This guy was regular. This person was dark. And I just remember when my dad told me one time that one of our best customers was having an issue with a person in the front of the cash register. And I just remember him walking up to the cash register, taking the person's, you know, the tab, the check, and he goes, Richie, shh. He's like, this one's on us. And then my dad took me to his office and said, Dad, you know, that's a $40 bill, man. That guy had like lunch. He goes, no, no, no. You see that guy right there? That's not a $40 customer. That's a $10,000 a year customer.
That's
Don't
right.
ever let $40 get in the way of $10,000. So anyhow, super excited that you were able to share that story. But I kind of want to know how has MVP over the course of the last, you know, year, you know, things have changed, a lot of change in this last year. How have you guys innovated to make things more of a customer centric experience for the
Yeah,
members
so
of
I
MVP?
think over the last year, we're starting to see the results of investments that were made about 3 years ago, right? So over the course of the last, let's say, year and a half, we've established 3 large partnerships with University of Vermont Health Network, Mass General Brigham Health Plan in Massachusetts, and Mass General Brigham as an institution and health system, and then also with Belong Health. So it manifests itself in partnerships, but it also manifests itself in terms of growth in our core health insurance business. But it started 3 years ago, and it started with core values, right? So I think when you look at cultures of innovative companies, you got to kind of start with, well, who are you? And so our core values really called out 3 things: to be the difference for the customer, be curious, and be humble. Be humble in that great ideas come from all walks of life and backgrounds. But to be the difference for the customer sounds pretty simple, but you have to define the customer, right? And so in health insurance, you have some products you sell directly to consumers, like Medicare Advantage or Medicaid managed care, exchange products. And then you have, oftentimes you sell them to employers, and you usually sell that, you know, through a broker channel, or maybe you sell directly or some associations. So you have this B2B business, then you have this B2C business, like in common vernacular. But the reality is we needed to simplify it, and we needed to say that we're going to define the customer very specifically and very simply, and that's our member. It's the end user person, you know, whether it's the employee that's a subscriber, but all of that employee's dependents, those are all our customers. So when we say we have 550,000 members, we have 550,000 customers. And then our employers are our clients, and our brokers and our provider network are our partners. You know, we kind of sit on this side of the table together and say, how do we best serve that customer? So core values, customer centricity, and then really understanding what are the unmet needs. And, you know, for us, we use a jobs to be done framework. So we used extensive surveys working with a world-renowned company in doing that, and really said, okay, for us as a regional health plan, how can we innovate to differentiate, right? And so then it comes into, okay, well, how are you defining innovation, right? And I
Yo,
know
how do you
you and I
define
have
it now?
talked about
Yeah,
that. Yeah.
let's talk about that.
Yeah, so I mean, innovation is like, all right, I'm big on simple things, complex concepts, and trying to boil it down so you can really connect with people on it, right? And so we said innovation is new sets of activities that create value for the customer, so our members, and the company. And you have to have both, right? Because if you're delivering value to the customer, but you're doing it in a way that's not sustainable, you know, you're not generating a surplus or a profit or a break even, and you can't reinvest in it, then it won't sustain. So innovation for us is new sets of activities that create value for customers and the company. So that was really important. And then we said, okay, well, where are you going to direct your innovation activities? Well, then we go back to those surveys, qualitative and quantitative surveys and interviews, very specifically about, you know, what is it that people are struggling with? For instance, one of the key outcomes that we looked at was minimize the time it takes to determine if this new health issue requires a face-to-face visit. Well, that's an enduring outcome, right? And it's highly important for people and poorly satisfied pre-pandemic and post-pandemic, right? And so we knew as a health insurance company, it wasn't enough just to figure out how to get them to select a good health insurance plan that fits for them. But we ventured into what is it that people are trying, what are they struggling with when they're trying to address a new health issue, or they're trying to prevent their health from declining, trying to maintain health. So those were defining what innovation was and defining how do we narrow the problem and say, well, focus your innovation activities, your innovation efforts and experiments on unmet needs of the customer. That was important for us because we're a regional health plan, but we compete, with big national health plans and other regionals. And you say, well, if you're not low cost leader, I mean, how do you survive and grow in business? Well, to grow, you have to differentiate. And to differentiate, you have to understand what do your customers want? What is unmet from their perspective, from the outside in, not from your product out, but from the outside in, as they're coming into it. And then what does the competitive landscape look like? So where can you fit in? So that's how we used innovation to kind of narrow the target, kind of get the organization focused in on, well, we're just living our core values. It's got to be the difference for the customer. So our innovation should be on creating value for the customers in the company.
Kind of two-part question was, did you and your team kind of go in with a set of assumptions on what you felt were kind of some of the problem areas? And were those assumptions either verified or debunked? And just curious if there was any pleasant surprises in there.
Well, you take an old guy like me that's been in healthcare for 36 years at this point. You go in and you're like, oh yeah, I this is what's unmet, right? And I've been on the other side too. I was a clinical pharmacist, I was a retail pharmacist, so I'm used to seeing things from the patient perspective, because you have to diagnosing and figuring out what's going wrong with the patient is generally pretty straightforward, right? What is trickier is the treatment plan that you decide on has to fit into kind of the context of that person's life. What can they handle, right? So we go in and we broke these surveys up, and we all had opinions. And some of us who were around in healthcare for a while, that we had certain opinions. Some of my employees that are in their 20s and 30s, they had an opinion. Some of my employees and some of our team members that have a spouse in Medicare Advantage, they have their opinion. But this is why we named our innovation framework evidence-based innovation, because what we did was we actually went out to consumers, some of which were our customers, many of which were not our customers, and said, well, let's collect data about them. So let's replace opinion with evidence. And then there were some surprising things, that we found there. And then there were some that were very, very validating. So like debunking, I know like sometimes there's a lot of effort that goes in from an insurance company to say, well, you need to deliver a great explanation of benefits to members. When you test that, that's not the issue, is how they used it. The issue is, did they understand their health plan coming into it, right? Were there surprises coming into it? So that was big. When we looked at, as I said, minimize the time to determine if I need to face-to-face visit. Well, that was really timely, right? So but that existed before the pandemic and now after the pandemic. The solutions are changing. But the enduring need, remains there. And so when you look at different populations, like we looked at the Medicaid population, and you'd say, well, in the Medicaid population, they're not concerned as much about cost because they've got a benefit, that's supported by the state and the federal government. And that's completely untrue, because what's covered is really important. The convenience of how can they get access to those services, because they may be working 2 jobs or 2 part-time jobs. They've got kids to care for, and then they're like, well, how can I get everything at once? That was really kind of eye-opening for us as well. You look at like the older population, Medicare Advantage, you're like, well, they really want to keep that relationship with their doctor. And it's true, but it didn't pop out as one of the high markers. What popped out as really high is the facilities that they had access to. And it kind of makes sense, right? Because Medicare Advantage, you're getting closer where you might experience some hospitalizations. I mean, some
Hmm.
of your subscribers may have never experienced a hospitalization in their life, except maybe for, bearing children or maybe a quick
Yeah.
visit to the ED. But in that Medicare Advantage population, then some of that facility and the reputation of those facilities, really, really mattered. So there were countless numbers of things that, people said, see, I knew it. And, other things that people said, oh, I guess not. It may be table stakes. Everybody needs to do that. Or just maybe, yeah, it's highly satisfied, but it's not important to people. So let's not invest any money there. Like that explanation of benefit piece.
Yeah, I think a couple thoughts here because you've been commenting around sort of the culture. Number one, someone that's looking from the outside as an outsider of MVP, I kind of sit back and I admire the leadership and the ability to sort of surrender to a process that you guys trust the process, and then going in without any expectations, and then letting the chips fall where they fall, and then saying, "All right, look, here's where they are." Talk a little bit about how hard is it to focus? You guys have like what 1,700 team members or some odd or more or less.
Yep.
How hard has it been to kind of focus and to get the ship to kind of fall under these areas of focus, and is that different for each of the customer segments that you serve? You mentioned MA, you mentioned some of the other areas. Like, talk a little bit about that because we haven't really dug into that much.
I mean, piece of cake. You have you have a 40-year-old insurance company that started in commercial insurance and then added, state programs and added Medicare Advantage, kind of along the way. But, yeah, it's a challenge, right? So changing the culture of an organization to kind of um, move from pure, risk management, kind of conservative. People are very connected to the customer, but it's been doing things a certain way for a long time, and I think over the course of the last 5 to 7 years, that's been changing quite a bit. So then you say, oh, you're going to bring in innovation, and I started as the chief innovation officer, and we had a 4-person department, but at the outset we said innovation can't be a department. If innovation is a department, we failed, right? Innovation has to be part of the culture, and we had it built into our values. Be curious, right?
Yeah,
Be the
yeah.
difference, for the customer. So we put in this innovation framework, and then you quickly run into a problem. Yeah, you get like leadership that buys into it. That's pretty cool. And maybe some of your product people that buy into it. That's cool. Marketing, they're looking at it. Wow, yeah, I like the way it tells us a lot about the consumers out there. But you need all 1,700 to kind of attach to it. It needs to become part of the way of how your organization does business. It needed to be part of what we call the MVP way. So how did you do that? Well, we needed to be more inclusive on our definition. We said, well, there's 3 general types of innovation at MVP. There's concentrated innovation, continuous, and comprehensive. And so concentrated, we put in the category of business process improvement. So for us, we use lean, right? Well, a lot of people are working on lean projects, and almost
Yeah.
everybody understands what lean is because we've been using it for 3 or 4 years at MVP. And we said, well, that's a concentrated innovation. You're an innovator. So we're going to tap the creativity within you. We're going to tap that innovation within you. And then we have continuous innovation. So that could be something like we have a product called GIA, which is kind of that's what faces the member to access
Hmm.
virtual care, information about your benefits, your ID cards, your claims, all those different things. And we said, well, yeah, we version that. We keep versioning that on a regular schedule. That's a form of continuous innovation. Anything that we version, in a big release or a point release. So lots of people are attached to those types of activities in the
Yeah.
organization. And then we have comprehensive. So comprehensive, for instance, is, when we're launching the Medicare Advantage product with University of Vermont Health Network. And in that sense, we said, okay, well, that's comprehensive. So we're going to put a little team together that's the only thing that they do is work with our partners at University of Vermont Health Network, and we're going to put together this Medicare Advantage product. We're going to identify the unmet needs in that market, and we're going to put a differentiating product into that market and position it so it can grow really quickly. And when you broaden the definition of innovation, not in an artificial sense, right? Not everybody gets a trophy sense,
Yeah, yeah.
but just getting people to recognize, hey, you're undertaking new sets of activities that create value for customers. And as you said, it could be in certain segments, maybe not across the board, but you're creating value for customers and the company. You're an innovator. And I think it was important and it was exciting, for people, for team members to feel that, like there's some excitement in the organization about finding a better way. And then in working with the partnerships, a lot of the team members were excited to say, wow, look at some of the organizations that we're working with. And because they're provider organizations, now we can solve kind of more of those unmet needs of members in an integrative, collaborative way. So we're early on in the journey. I'd say we're kind of halfway there. But we trained over 100 people on kind of our evidence-based innovation data, that jobs data, and we've got them out in different parts of the organization. And we don't have an innovation department anymore. It's just part of what we do.
Yeah, it's kind of like a lot like when people talk about innovation, is it just a box that they check, or is it sort of a living, breathing ethos within the organization? It sounds like you guys got pretty serious about, we don't want to check another box here. We want to actually do it. We want to say that we're doing it. We want to walk the talk. And kind of goes to your point when you mentioned about who is the customer. I kind of view it in 2 points. There's the external customer, the people that you serve, but then you have your internal customers, the people that also help those external customers. And you gotta kind of have to feed those as well. So there's kind of dual parts of innovation that are happening. Shifting gears a little bit, Dominick, I'm curious, you mentioned about some of the front end products that interface and kind of can help navigate members towards certain services. What's your take on sort of internal innovation that's sort of native in out and then out in? What does that look like, for MVP, and, comment on that, react to that?
You mean whether or not you're developing that kind of all in-house or you're working with
Yeah.
external innovators?
Yeah.
So it's a mix, right? And sometimes when you get it to the point where you can get it to scale and you've developed the capabilities or the assets necessary to do it, that might be a time to bring it in. But for instance, like we did a partnership with Belong Health, which is a VC-backed organization by Maverick Venture Partners. We focus on the DSNP population, right? So the dual special needs population, they're eligible for Medicare and Medicaid. And they tend to have needs that are not only medical needs, but needs that reflect challenges they have with transportation or food or housing or whatever it may be. Certainly literacy is another challenge. And DSNP was a new product for us. We had Medicare Advantage, but we didn't, and we have Medicaid, but we never served that population. So Belong Health came along and said, well, we have a way of engaging these members through care management techniques, that the team that they assembled and put together, and said, well, we want a joint venture with you, literally in a joint venture, and say, let's serve this population together. And we learn from each other. We educate each other. We first seek to understand before being understood. So you need to do that with your external customers, like you said, but you also need to do that with your partners, right? Because you're trying to say, like, what assets do you have? What assets do we have? Make sure we understand them. And then how does 1 + 1 = 3? But you fundamentally have to have a shared customer, external customer, I think, that you're focused on. Your values have to align, right? And you need to understand each other's kind of success metrics at the outset. So we have a tool called that we use from the entrepreneurial operating system called the Vision Traction Organizer that we kind of use that with our partners and say, hey, here's a way for us to get on the same page. And if we're going to work with an external innovator, we want to know that in advance, because it's not always a great marriage, right? But if you can do the discovery and find more out about each other, I think then you have more successes than disappointments on the back end.
Yeah, I'm a firm believer that, relationships that are successful are made or broken in the beginning, not in the end.
Absolutely. It's on
You'd
the
rather
left
get
end
to
of the
know, yeah,
process.
you'd rather get to know that. And it's a breath of fresh air to hear that you are looking at partners that also have the same set of values that you guys do. I can't tell you how much I appreciated hearing that. That's pretty
You're going to
pretty
get tested
fantastic.
at some point, right? In the process, because it's a relationship. It's a long-term kind of profound relationship. We don't have thousands of these, right? We have armfuls of these relationships,
Yeah.
and we want them to be long-term. And how do you know when you have a great relationship? When you face adversity, not when everything is going, great. And when you face adversity, that's when your values matter, right? That's where you want to apply those values. So you're going to hit ceilings, but as partners, you can push through it if you're aligned on who you're serving, and you're aligned on the values, and you're aligned on what success means to each organization. And so isn't that better to know, as you said, on the front end of the process, and rather than say,
Yeah.
before we get married, you know what, I don't think this is going to work out, right? Because divorce is expensive for everyone.
Yeah, and honestly, even in some of the earlier stage companies that I've met with, the more mature ones, the ones that are more seasoned, experiential wise, are asking those types of questions and saying, "Hey, how do you deal with conflict? What happens if things go off track? We know that things aren't perfect. What does that look like to actually get things back on the rails?" And you kind of want to know that. How do people act in conflict? Are they nice, or are they, breaking out the knives and throwing people under the bus? I mean, that's you kind of want to know that
Yeah, and at
as
every
much as you
level in
can.
the organization. So we have a partnership experience framework and a governance process that we have a vision committee, a strategy committee, and an execution kind of committee where we deliver the innovation, that we're delivering. And so we have interlock, between each of those. And there's escalation points, there's catch points. And, we try to celebrate our successes. Many of my team members are much better at celebrating successes than I am, right? I'm like, okay, we did that. Now we got to kind of roll onto this. So that's an important component of it. But when issues arise, you want those issues prioritized and solved at the right level so that they go away forever. And like a predetermined structure of how you handle it. And then those values, as you said, in dealing with conflict, to say, yeah, this is natural. We're going to arrive at these points. It's how we behave at these points and how we solve problems together. That's what will dictate the success of the relationship.
So what are you most proud of so far in your time at MVP? Is there anything that really kind of sticks out to you? Any stories, any accolades, accomplishments as we kind of round out this interview?
Yeah, I think it is that we focused on the customer and said we need to provide more of a platform for our members, because people don't wake up and say, boy, I want to buy me some health insurance today, right? It's kind of like a necessary evil. So, but we looked at ourselves as more now as a health services company that says we need to solve for the unmet needs of these members, some of which is maintaining their health or stopping their health from declining. Some is how do they access is a big issue. How do they access clinicians and providers and other services? So I love the fact that we perform these job surveys on a broader set of needs for our customers. We looked at it from the outside in. We looked at it through the customer's lens into us, not from our product out. And that forced us to say, okay, if we're going to innovate to address those needs and deliver on those consistently, we need to work with partners. Sometimes it's vendor partners, right? Like some of those startups you talked about, but many times it's the health systems and the provider networks. And our ability to do those relationships, like for instance, the University of Vermont Medicare Advantage relationship, we came out of the box. It was one of the fastest growing Medicare Advantage plans in the Northeast. Why? because we listened to the consumers of Vermont and Northern New York, and we got together as a team and we co-created a Medicare Advantage plan and services around that were aimed at supporting those members. And it took. So it was a proof point on our approach. It was a proof point on our partnership. And, now we're bringing that, to the next level. I mean, our goal there is we think we've got a great product. We've got a great partnership. They'll both continue to evolve, but we're laser focused on that customer. And, our goal is to be the number one provider of Medicare Advantage in Vermont and Northern New York, because our partners and our team members believe in the product. So I'm most proud of those partnerships, and then it gets recognized by organizations like Mass General Brigham Health Plan, who said, hey, we want to pursue and launch a Medicare Advantage plan in Massachusetts, primarily in Boston to start. And we'd like to leverage some of your expertise and be a good partner. And that's where I think being a not-for-profit helps. University of Vermont's a not-for-profit. MGB is a not-for-profit. We're a not-for-profit. So I think there's a path forward for not-for-profit organizations that work with for-profit organizations and vendors and partners to really deliver solutions, because we tend to align on values, and then we can take advantage of some of these external innovators, that are working on all the cool stuff and kind of bringing it to the fold. So I'm most proud of how we've kind of gathered together to say, here's the customer that we're looking to serve. Let's provide unique value to them. Let's differentiate, and that's our path to growth. So that's the product.
It's impressive to hear that. Number one, listening to the customer, taking that all in, and then just executing at scale. Because look, the strategy is probably the easier part. The execution is the hardest part, in my opinion.
Yeah, if there's 10 strategies, you'll pick one of the 3 that's going to work. As you said, the question is, how do you go from vision to execution?
Well, it sounds like you guys have a pretty good recipe that's working, and you're turning out some good cakes. So
yeah, so far we're going to keep the momentum going.
Well, tell how can just kind of spotlight on you. How can the audience follow the work of MVP Healthcare? Tell us how we can kind of continue to support, and how can we add value to you guys?
So MVP Healthcare has both the LinkedIn site, and mvphealthcare.com is our website. I'm Dominick Bizzarro on LinkedIn is the best way to get me. I'm also on our webpage. There's not a lot of Dominick Bizzarros on LinkedIn, and there's only one on our webpage. And we're really looking to kind of share that story and tell that story more, because a big part of it is getting the right people on the team and increasing the diversity of thought and contribution and background that we bring to the team. And so we like to kind of get the word out there, because in today's hybrid world and remote world, we're always looking for great, talented people. But we also want health systems and payers out there to know that we could bring value to them and share our experiences with them in one way or another. And it will result in great products and great services for your members.
Well, Dominick, it's been really delightful to chat with you today. I think you're between your stories, the 3 C's, there's a lot of golden nuggets in here that I think people are going to get. They're just going to get a glimpse of your intentionality around customer focus, whether that's like external or internal. So for those that are tuning in, if you found this content helpful for you, would you mind sharing it on social media? Would you mind liking it, subscribing, maybe put in some comments, tell us what you thought, some of the things that stuck out to you. I'm just really grateful when those around us are actually making a difference to advance healthcare, moving it forward, and bringing in more innovators, more doers into the community is always a good thing. So I'm looking forward to connecting back with you, Dominick. You're always welcome to come back to the show, maybe sharing even more wins in the future. But it's been an absolute pleasure.
Yeah, thank you for the invitation. I think the work that you're doing here is great work.
Awesome. All right, well, we'll be in touch. See you soon.
All right, take care, Michael.